Please welcome Andrea Bell to our show today. Andrea is the Advisory Council Chair for the Global Health and Fitness Alliance, also known as GHFA, as well as the co-founder and director of Inspire Brands Asia. Andrea, thank you so much for taking time out of your day today, coming on to the Fitness Business Podcast.
Thank you for having me. It's an absolute pleasure.
Yeah, I got a chance to and the opportunity to meet you at IRSA. So it's like, hey, yeah. I love that our paths are crossing again. Fantastic.
I know. That was amazing.
So you are on the Advisory Council Chair for the GHFA, like I said, also known as the Global Health and Fitness Alliance. And for many of our FBP family, they might have never heard of this. So who and what does this alliance do?
So it is fairly new in the industry, so I wouldn't be surprised if they haven't, but definitely know these terms, GHFA. The Global Health and Fitness Alliance was put together through a collaboration with top leaders in the industry at the beginning of COVID as an IRSA initiative to try and help support the industry better through COVID. And then they realized through those discussions that there was a big gap in our research, and what we needed, a biggest problem with all the industry across the globe was having conversations with government that was impactful enough to get them to understand that fitness is essential, that our industry is essential and should remain open, especially when we were closed with the likes of spas and bars, right in the very beginning, and so many other services and industries were allowed to stay open. So through that, we realized that we have no research around how effective we are at helping public health and really shifting that needle of in terms of the physical inactivity. So they put together this report with Deloitte through amazing support from industry leaders. And it took us just over a year to get that report and that data together. And at IRSA in Miami, when we all got to see each other, which was also amazing, sidebar to see people face to face, was that we launched this report, and it now is out there to be used, and we need eyeballs on this report. So yes, that's why I'm trying to spread the word, spread the good word.
And how did you become a part of the report?
So I initially was not part of the council. I had some friends and knew of the council itself. And at that point, I was still the Chief People Officer for Anytime Fitness. So Inspire Brands Asia owns the master franchisee rights to Anytime Fitness in Asia. We've got 9 markets. And I was working with John Holsinger from IRSA for the last sort of year. I always had Anytime Fitness in Singapore signed up as members. So we were just, always talking, staying in contact. And then they asked me to be on the council last year. And I found that really impactful. I wanted to be able to help the industry at a much better level, higher level, I suppose. And so when they asked me if I would be willing to step in as or at least be voted in as the chair, that was in March this year. It was perfect timing because I was stepping down in my role as Chief People Officer. And so I got voted in as chairperson, and I'm happy to help the council lead the way.
Yes. And we're so glad that you're here reporting on this and just educating all of our FBP family and out there listening today.
Thank you. It's amazing cause.
Andrea, could you please explain, what is the Deloitte Economic Health and Social Wellbeing qualifying the impact of the Global Fitness Sector Report that was commissioned by the GHFA?
Yeah, so it's a really heavy report, and we did it across 47 countries in the world. So it's very significant impact to the global industry, and also the MENA region, so the Middle East region as well. So we have this report that now enables us to have a dollar amount per person per year in all these countries on what it costs government, medical, big business, insurance to have a person be physically inactive. So that is essentially just such an impactful dollar amount. And so, for instance, to put some accuracy on it, in America, it's around $3,500 per person to be inactive. You times that by the population, that's just 1 year. You times that over a lifetime of inactivity, and we're talking trillions of dollars. In the States, in say Singapore, it's in a couple of $1 billion a year. So it is massively impactful to have this data now for us to be able to have those conversations with the right people and say, this is what it's costing public health, society to be inactive. It's that important.
Yeah,
essentially that's it.
I don't want to say that I necessarily read every word of the 60-page report.
What? How? Geez.
I did really, I feel like, thoroughly look through the 64-page report.
Yeah.
Just to kind of fast forward for our listeners out there, could you maybe pull out 3 pieces of data out of that 64 pages that maybe would interest our listeners?
Sure. So the 3 key points would definitely be, number one, the dollar amount. It's what everyone goes to. They flip all the pages and say, let's just get down to the business. It's the dollar amount it puts on all these economies. And it's the socioeconomic impact as well as the economic impact. And that's what's so important about it. So dollar amount, the fact that we now have this document put together by industry body and Deloitte, who have done all the reports for us all these years, in which, we all know are so impactful for us. We can now use that to go and have conversations with government, to go and have conversations with other big corporate industry, and hopefully eventually insurers, so that they can start understanding that if they can push their members to be active, and doctors, the medical industry. I mean, I know there's lofty goals, but this is what this report is about. And third, it's also about getting the consumers active. And so the GHFA is working with the World Health Organization, and their goal is to decrease physical inactivity by 2030 by 15%. And so this report then is going to be able to help us have those conversations. So dollar conversations with government, and then consumers, and getting them back to being active.
Yeah, and I think the conversations with government is really important. And I know I've really seen a big push the last, I'd say maybe the last 3-4 years with that topic. So I think we're only going to continue, really to move forward on that. I know you.
Yeah, definitely.
Yeah, I know you kind of just touched base on this a little bit, but I'm just going to kind of rewind a little bit. And that's, how do you think this report will be used, and really who in the industry would use this report?
Honestly, we want everyone to use this report. So what we're doing is we're pushing it out to the fitness alliances that are in each country. If the countries don't have a fitness alliance already, then we want to be able to help them establish them, because the people that are in those markets, they're the ones that need to have these conversations with their governments, with their associations and medical bodies. So we want to be able to help them establish that, so they can use this document, get eyes on it. We need eyes on this report. We can't let it sit and gather dust. Otherwise it's, not worth it, of course.
Yeah. Now, when I was flipping through the report, I saw how it was broken down: Australia, China, and the US. And I saw like Australia, it said that going to the gym is the second most popular physical activity there after walking. I thought that was pretty interesting.
Yeah, so this is the thing across all markets where it's not one conversation. That's why we can't do it as a council. We need the people on the ground, because every country is at a different level in terms of how they're approaching exercise, the penetration rate. Of course, Australia, America, England have the highest penetration rates. And so, meaning like the number of people that are being active. In Australia is a very active country where we're always doing things, but in countries where like Asia, we're much further and we've still got a long way to go. It just means that the opportunity is a lot bigger. So it just depends on the country and the market, and we want to be able to have those conversations to shift that needle.
Yeah. Now, so moving on from Australia, I read the China section, and it was interesting to see that the Chinese government has always attached itself to the importance to exercise in the citizens' physical health. So I thought that was pretty interesting.
Yeah, and this is the thing, like comparing the different countries, when you put all the dollar amounts together, it can be a little deceiving because, for instance, in America, it's $3,500 per person. Now, that's because the medical costs in America are so much higher. In China, the dollar amount is a lot lower, but the population, of course, is just immense in comparison. So when you compare that and add the sum total together, then it's just, you know, an incredible number. It's in a lot of zeros.
You know, you said about the medical expenses in the States are just astronomical. So it's funny because when I then read about the US section, it said that there's a rising trend to move health services out of inpatient hospital settings to avoid, you know, the hospital costs at, you know, when possible.
Sure. So this is one of the reasons we can use this report too, is to hopefully get the medical industry to shift. And I know that's a lofty goal, but if we get them to shift so that we can get more outpatient, get doctors to start prescribing exercise as medicine, get them to start thinking, go out for a walk instead of taking a Panadol, you know, like, or a Tylenol. So we have to start thinking differently, basically. We all know this, but, you know, it's trying to get the other industries to follow suit.
Yeah, I agree with you on that 100%. We all know this. I mean, we, you know, every conference that I'm at, this is a heavy topic and we all talk about this. It's just trying to get it, out of our little bubble of the fitness industry and move that to all the different industries, you know, around us.
And that's exactly why we have this report, Dori, so we can be able to take that and start having these conversations. Because, I mean, you're right, like at URSA, the education is amazing, all these conferences amazing, but we know this stuff. We need people to come, other outside industry to come to our conferences and get wrapped up in the excitement and what we can do to really help shift, you know, physical inactivity. So this is like, please read the report, send me an email, talk to us. Happy to talk all day about it because it really is making sure we get more people talking about it, using the report and eyes on that report.
So for all of our listeners out there that are like, well, how do I get my hands on this report? Where can people find out more or to get the local version of the report?
Yeah, so they can go to our website. We've got the GHFA has a website, GFA Alliance.org. I think we have every dot out there known to man. So type it in, I'm sure it'll come up. You can download and purchase the report online. If you're an URSA member, of course, then you get a discount. So hopefully you are. Otherwise, contact your fitness alliance if you have one in your country, or send us an email, and we're happy to get help get an alliance started as well.
Yeah, and we'll also make sure we put a link also on this episode as well that will help people get where they need to be. You know, we here at the Fitness Business Podcast have been trying to do our part in getting more people on our episodes talking about, you know, the medical industry combining with the fitness industry, and it's been a challenge. It's just like, oh yeah, it's a great idea, but you know, we need doctors writing scripts for personal.
You know, it's quite interesting. I'm not sure if you're aware, but in South Africa, the one of the biggest insurance providers there, AIA, they offer their members discounts on their insurance rates when they attend the gym, and they have an amazing system set up there. And I just don't understand why the whole world is not doing it. This is amazing. So if we can get like one insurer doing it, like, come on, like, we need more. So hopefully this GHFA report will help with those kind of conversations. We just need some precedent set and some, you know, data points put in there. So that's the other thing we're doing now, is collecting more data points so we can have these case scenarios and case studies to prove that it works. Because at the end of the day, we all know it does, but we've never had actual proof. Now we have that. And so this is what we're doing now with the council, is we're pushing forward, getting more data so we can have more of these, you know, pointed conversations with the relevant bodies.
Yeah, wouldn't it be great at the next URSA conference if we could somehow get more of the medical profession to come to our conference, you know?
Goals.
Come on, URSA.
Do it.
Let's go.
Let's go. Advocate. Yeah.
Andrea, you know what? Thank you so much for, just coming on and enlightening everybody, even myself, like I said, that's why I actually took the time to, I don't want to say peruse through the report, but, I looked over it pretty well because I was even unfamiliar with it. So this episode for myself opened up my eyes.
Yep. Thank you very much for having me. It's been an absolute pleasure. And, always happy to talk to anyone in or out of the industry about the industry and getting people more active. So feel free. I'd love to have a conversation. Clearly I can talk. So.
Are you going to be at URSA in March?
I'm hoping so. I am hoping so. I'm aiming it. Liz has asked me to get there. So I'm trying.
All right. So are you sailing around the world before March or after March?
that is the issue. We're trying to leave in Singapore in September, hit Asia, and then we'll see where we go next. So and luckily we've got it all set up so I can stay connected. So I can stay on Zoom and so we'll see if I can get a flight though.
Perfect. Well, thank you again, Andrea, for taking time out of your day to come on to the Fitness Business Podcast.
Thank you so much, Dori. Really appreciate you asking me in.